opening remarks on Senate File 2270.
Thank you, Mr. President. Well, this next bill is about finding opportunity, solutions, and remedy amid an insipid disease that is now affecting 5.5 million Americans. 69,000 of those are Iowans, and it also affects more than 200,000 people under age 65 across the United States. Alzheimer's and related dementias rob our loved ones of their dignity and memories, and it is a disease with mystery and is ever growing, especially in Iowa, with our already aging population and our baby boomer demographic. Almost everyone here could raise a hand that you know someone who has Alzheimer's, much like the acknowledgement of cancer and heart disease. Well, here's what Senate File 2270 does. For those affected by Alzheimer's, the state of Iowa, and the people we are here to serve, it asks that we create in the Department of Public Health a state-level, long-term coordination of and a comprehensive strategy for Alzheimer's. From that, we create a multi-year comprehensive approach with short-term and long-term objectives, and that the department assigns a dedicated full-time coordinator that will work with public and private groups to coordinate public awareness, demystify and encourage public awareness and understanding of Alzheimer's. We have an opportunity here to get ahead of an issue instead of reacting to it, by pulling everyone together in the state who's working towards solving the issues around Alzheimer's, which include research, caretaking, and, yes, workforce issues. We would be the first in the nation, and should be, in regard to this. Mr. President, if there are no questions or comments, I ask that we move the bill.
There is further discussion. The chair recognizes the senator from Webster, Senator Beal.
Thank you, Mr. President. Ladies and gentlemen, friends and colleagues, I rise in support of Senate File 2270, and I do so not so much out of respect and care for the Alzheimer person who has Alzheimer's, but for the caregivers. This is an insidious disease. It's a family disease. My father had Alzheimer's, and my mother was a caregiver long before I even knew he had the disease. I think the saddest part of his 7 or 8 year battle with Alzheimer's, there's no remedy. It's always fatal. But I think the saddest part was when he knew he was losing his ability to think. I remember how sad it was when he would get within 2 or 3 blocks of home when he was driving and not know how to get home. He always did what he called checking up. He reconciled his checking account every month. Towards the end, he would belabor hours on that, and he says, "I just don't get it. I can't get it." After a while, it made no difference to him, and that was really not quite as sad. But I guess I rise in support of the 15 million Alzheimer's providers, those wives, oftentimes spousal units, that provide the care during this long goodbye. I applaud Senator Mathis for running this bill. We can all take an active role. I've participated for several years in the Walk to End Alzheimer's. Much research is necessary for this, but today we can start the ball rolling and pass this legislation. And again, I view it as probably more for the caregivers than I do the Alzheimer's sufferers themselves. Thank you.
The Senate will pay attention to the results of the roll call. Those voting aye, 44, no, 6. The bill, having received a constitutional majority, is declared to have passed the Senate.